My name's Shagun Aggarwal. I'm a plastic surgeon in Sydney. I have a private practice on the North Shore, and I also work at RPA in Prince of Wales. In terms of fields of plastic surgery that I specialise in, I do a combination of public and private work. I really enjoy doing breast reconstruction and microsurgery. That's been my focus of my practice and also what I did my fellowships in. And I do enjoy doing a fair bit of cosmetic work, mainly breast and body focus, but really head to toe, everything. For me personally, to be involved in the Australian Society of Plastic Surgeons is, as a surgeon, I feel like I'm a part of a certain calibre of like-minded colleagues. They're all specialist plastic surgeons, number one, and also they're of a certain standing. They all do a variety of breadth and depth of plastic surgery. And they're also involved in education, which I really enjoy. And I think they also advocate for us as a group of surgeons. And I guess more recently, there's been a bit of debate about specialist surgeons and those who are not. And that's been really important, I think, for us as a society. I think for a community as well, it's really important. By that I mean they have a place to go to see who's proper specialist surgeons, how to find them. And they actually advocate on behalf of the community as well. And we saw that recently with the tummy tuck number being reinstated. So yeah, for all those reasons, I think it's important to be part of the society. For me, attending PSC and other educational events, they're important for quite a few reasons. I think number one, it sort of gives you an idea that your practice is very evidence-based. What you're doing is currently the best practice. It allows you to peer review, see what your colleagues are doing. And also they're sort of pushing the boundaries and seeing, what's new out there, what can you adapt? And just for purely a social perspective, that you get to interact with peers, both local and international. I became a plastic surgeon because it sounds a bit weird, but I always wanted to do something with my hands and do something very procedural. One of my interests has always been art, and I don't know, when I was going through medical school, I felt I really liked anatomy and where could I use it, and I could use it in plastic surgery from head to toe. I do feel it's where it's quite creative and attention to detail matters. And so every day I feel like I'm employing my enjoyment of surgery and anatomy, but also being a bit creative, and I like my attention to detail. There are several challenges facing the industry, I feel, but I think the most prominent one at the moment is just the adequate training of surgeons and using the title surgeon. I think, unfortunately, in Australia, the law doesn't really differentiate from who can call themselves a surgeon or not. So I think it's important for the public to be well educated. And again, I think our society is really good for that they can advocate for us and also highlight that specialist plastic surgeons have a certain amount of training in the post-graduate space. They've trained often for about 10 years. They have a certain standing in society. They work in public and private hospitals. And I think where it comes down to patients is they need to be taught that once you have a procedure, it's also the aftercare that matters, that if things go wrong, they have someone to turn to, they have a hospital they could go to, they can be admitted if there's an infection. And that aftercare is, I think, that what really differentiates us from other surgeons.